My name is Tembile. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists. People call me Dr. Alternative out of endearment. The health industry, or health, has got two dimensions: the alternative dimension and the medical dimension. But unfortunately, these two dimensions don't talk and they don't collaborate, to the detriment of the recipients, that is the patients out there. I am the epitome of these two dimensions.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
I'm inundated with requests and calls from our clients, particularly those that do not have funds to buy medication. They are sitting with huge balances in their medical aid, which they can't use because of the nature of their illnesses. There's no diagnosis, or the treatment does not seem to work. So they can't use that money. And while me, on the other hand, I'm sitting with answers to their problems as to what the diagnosis is and what the treatment protocols are and what it's going to cost them. But that money must come from their disposable income, which is not a lot because it's meant to cover their day-to-day running of their homes. So that is the bottleneck. Because while I am capable of bringing a turnaround in their health situation, I am a medical intuitive, and there is no space for that within the council. So that is the problem that is facing people today. And in our show, we're going to be looking at that. Who suffers? Who has got the power to change things? Who has got the power to decide what and how much should go where? And can the clients, or can you viewers, do anything about that? Or have you got any say or power at all to effect changes in that situation? So our show today is going to be exploring this scenario and trying to map out the way forward, if there is any. My name is Tembile, and I am a medical intuitive. In our studio, we've got our guest, as you know him, who's going to introduce himself.
Very well, thank you. I go by the name of Ulukoro Nundwana, and definitely we're just going to touch base on the medical aid coverage. I'm sure we can never run away from that, but this seems to be a big debate. Mm-hmm. You know, it definitely seems to actually be like politics. Is it actually politics? You know?
Yeah, everything is politics, actually. Mm. I mean, seriously, even church is politics. Everything is politics. Because at the end of the day, it boils down to who calls the shots. Yeah. Whether people who call the shots, they've assigned themselves to those positions, or whether it's the people that they are serving that have given them the power, whether the people who have put them there really have the power. So at the end of the day, it boils down to who calls the shots.
Let's be honest, man. You speak about who call the shots. Who actually does call the shots?
Who does? I mean, I'm sure every person, every viewer is I think this is kind of triggering some thinking in a lot of people, because at the end of the day, I remember my husband used to say at home, I'm just digressing. My husband used to say, women are the government. He used to say it in Xhosa at, oh mama, ngorhulumente, you know. Yeah. And I know his friends would say, and they say, you are fooling yourselves. If you want to face the truth, the person who calls the shots is the woman. You may be standing there in front and thinking, I'm the one who's deciding if we're going to buy that car or not, or if this is the budget or that the budget. It's the woman who decides the budget but comes to you and presses certain buttons, and you end up saying, okay, let's go buy the car. It's you who says we buy the car, but the person who's worked behind the scenes to make sure we get that car is the woman. So, I mean, we used to laugh a lot. So that was my nickname. People used to call me, hey, Khulmente. All his friends used to call me Khulmente because that was now the word that he assigned to every woman. So he said, oh, I don't fool myself. Me, my wife, I accept that Khulmente. It's the government. So it's to call, hey, Khulmente, you working person? Hey, Khulmente. So people never even used to use my name. So he had a great sense of humor. So what I'm getting at is that people who call the shots are people who can decide what goes or what doesn't. Yeah. So if you pay the money, but you cannot decide what happens to that money, you're not really, it's not just only about money, it's about a whole lot of other things. Whether you've got, because remember there's temporary power, and there's real power, if I may put it that way. That if you look at politics, people who've really got the power, it's the people who vote. But whether that power is diluted or is dissected into practical manifestations, where you say if this is what should and shouldn't happen, that's another story. But the person who's really got the power is the voter. In the case of our topic, or in this context, the person who's got the power is the person who pays for the medical aid. Because it's your money. I promise you, it is your money. But the Medical Aid Society is the one that hijacks the power and ends up looking as the person or as the entity that has got the final say. But by right, the person who has got the authority and the power to decide whether you want this to happen, because it's your money, you pay the money, you pay to the medical aid. If you stop paying the money, the medical aid has got nothing to control. It's your money. But they create systems, because at the end of the day, you've got to have systems of operating this pool of money. And they come in. So you need them. It's not like you don't need them. But the unfortunate thing is you find that there is no partnership. You pay the money and they call the shots. They decide, no, we're not going to use it on this. But it doesn't mean it's an easy-weasy kind of thing, because even for them, they still have to make sure that the medical aid system runs. Because it's a complex operation. Because if I pay 20 Rand on a monthly basis, but then I'm going to end up needing R1 million to cover for me at the hospital. Meanwhile, because if you were to calculate 20 Rand on a monthly basis over a year, maybe over even 5 years, it won't even amount to much.
Yeah, true.
But when you claim you need 500,000 Rands worth of hospitalization, a coverage or bill. So they need to, so it must work. So what I'm getting at is that it must still work. It doesn't mean what I'm advocating is that it must just be, you just throw money, you just decide. No, it must still be systematic. It must still be managed well because, and you must still, you know, these actuarial scientists, they calculate beforehand to say, if we have to have a healthy medical aid coverage, then each person must pay so much to they calculate all those things in advance, so that then you need to have so many members, because while I'm claiming that maybe 5 of these people are not going to be claiming, so I'm using their money to cover for you, okay? But at the end of it all, it must balance. You must not come have a situation where when they all come and they say, I need to go, and then you find, the medical aid has collapsed. Because, you see what I mean? You must make sure you're balancing all the scales. You know, every component is taken care of. So what I'm getting at is that while the people who are contributing have got the power, they still have to also make sure that the medical aid is running a healthy and a professional entity that's going to ensure they are covered. So that is why you'll find the medical aid will say, allocate a certain amount. Because if they've just got a carte blanche allocation, then they will fall. Just like it happened in the past. I know there are a lot of medical aids that end up collapsing because people would go and take their friends and their friends and their friends, take them and they were in collaboration with doctors. Then you find they go and buy nappies from the chemist. They buy cosmetics and all that. And then the doctor would write a script and where it would cover. Yeah. You know, there was so much corruption around it. And there's still
argue that definitely is still corruption. And even most people now don't even have faith.
Yeah.
Because it doesn't really cover everything, the most important stuff.
No, but it comes to what I'm saying, that for that medical aid to continue existing, they've got to make sure that there's an allocation of a certain, because if they just say, you've got R1 million cover, you can just come and go as you please, that's what makes it to collapse. So they must allocate that, okay, for hospital, there is this much. For dentist, for your specialist, for your eyes, for your ears, for your whatever, you know. So they've got to allocate a certain amount. And even those amounts that you find they allocate, those amounts are not thumb-sucked. They are also guided by these actuarial, scientists and all that. But what I'm getting at is that those are not the areas that I've got concerns on, because I go along with the medical aid being able to be sustainable, okay? So that at the end of the day, when the person needs help is available. But I'm talking about the fact that medical aids are designed to just service conventional medicine. More conventional medicine than even the patient itself. Because they will cover all that, but when it comes to alternative, there is not even an opening for that type of thing. Even those few medical aids that say, we do cover homeopathy and whatever, chiropractor and whatever. But even there you find they determine, it's not from the alternative perspective that I can say this is, they decide, okay, out of the 100%, maybe we can give 5% to homeopathy. If you happen to need 30%, tough luck. And even the 5% that they allocate, they still decide, are you registered maybe with SAPRA, or are you, what's your story? You know?
Because one would argue and ask you this question. And this is a question that I also want to ask you now. But are you a scientist? What proof do you have?
Yeah.
Because now people really now these days must believe in say.
Yes, yes.
And not just like, are you also now
a fly-by-night kind of...
night, or you just here for the money?
Yeah.
You understand?
Yes, yes.
Are you a scientist?
I'm actually even better than a scientist. Okay. Maybe, I don't know, I'm gonna answer that seriously. But my question is, for the viewer, what is a scientist? What is a scientist, really? Because a scientist is, or let me say science. Science is a collection of knowledge and information that has been verified, that has been observed, that has been researched, and have been proven within certain expectations to meet, to meet those expectations or those requirements. But it is an accumulation of knowledge. It is an accumulation of information, of facts that you can verify. You must be able to say, I've done this works. And if a person comes and tests it, they must be able to say it works. Okay. That's what science is. And that's what I do. But now, they've taken it further to say, for you to be qualified to be called a scientist, so and so must certify you, or this particular institution must satisfy you. Fair enough, because that controls chance taking. That controls fly-by-nights, particularly when it comes to health, because you can't gamble with people's health. Okay, so that so that is necessary. But those are the standards. Now, when something comes and falls outside these standards, because that's where I come in, I don't fall within. When I say I don't fall within, I mean what I'm capable of doing ticks all the boxes. Can you verify this information? Does it work? Can you explain? Can you observe? All those things I will tick. But when it comes to who is now going to say you meet these requirements, then I fall outside that, because who's supposed to certify me? I mean it. Who's supposed to certify me? Because if Mdzingi is the institution that is supposed to certify doctors and say, okay, you've passed this physiology, 1, 2, 3, you've passed, anatomy, you've passed, MPC, pharmacology. So they've got their own predetermined mechanisms and steps that you need to follow in order to qualify. And a person who qualifies you has got to meet certain requirements. And the expectation or the belief is that the person who certifies you is supposed to be above board. So many steps above you. And then if he meets these and then he becomes a professor. Fair enough. When it looks fair enough. But now what happens when I come and I am not using your methodology, I'm not using your practitioners or your teachers or your what, and I come to answers that you yourself cannot even give to your students. So they fall outside your scope, outside your depth. And I come with those answers. So who is supposed to certify me? And when I say I come with those answers, I'm not doing a lip service. I take a case, put it there, and I say, go for it. You know, just to make, because I like to make references so that people are not saying, she's blowing her own horn. I'm not blowing my own horn. I've got I've rigorously proven that what I say and am capable of doing, these are the results. I wrote to a cardiologist just recently. I'm still expecting them to give me a response. It's a white cardiologist in a private institution here in Port Elizabeth. I wrote to him, and I'm actually asking for a meeting because I know they are sitting with a huge waiting list for heart transplants, and they are sitting with a waiting list for pacemakers. I know they say it doesn't take that long to have a pacemaker implanted, but then they're sitting with people who don't qualify to have a pacemaker, but who are struggling with cardiac and suffering like crazy. So I wrote to him to say, can we meet? And I quoted some of the patients of his that I've treated successfully. So when I made a booking, first before I could write an email, I've called this receptionist and I say, can I talk to Dr. So-and-so? Now I've specifically called him because the patients that I've treated were his patients. So, and then she said, okay, what in connection with that, we've got to go through all the connections. And I said, no, because I want to have a meeting. In connection with what? I say, I want to talk about offering some services to some of the patients that he is stuck with, those that are waiting for transplant. Then she was quiet a little bit. And then she says, now remember, this is a black accent. It's not even a white. It's not even a white accent. And then she says, oh, do you provide aftercare service to patients, to cardiac patients? I said, no, I fix them. And then she was quiet. And then she said, what did you say your name is? And then I gave her the name, and I said, okay, send me an email. I can't put you through to, you can't just phone, I can't put, just send me an email. And the email does not go directly to the cardiologist, goes to her, and she must sift through the emails to see if this qualifies to be sent to Dr. So-and-so. So and then after a few days, I still don't check on my emails, there's no response, there's nothing. So then I call, and then she says, oh, no, it was not that same person. This one sounded colored, the accent. And then apparently she's relieving, And then I said, can you check on on the emails? And I gave her the email address. And then she comes back to me. She said, no, Dr. So-and-so, he does not go through his emails frequently because he's inundated with these emergency cases. He's forever called in hospitals and all that. But when he gets time, it's not just you, because there are also doctors who are making appointments for their patients. But she says to me, no, I went through email and I actually looked for these patients. She said, I looked for these patients. And she said she was actually fascinated by one particular patient because she knows the state of that patient, how bad she was. And she said, that patient has last seen Dr. So-and-so in 2016. And I say, you know why she's not seeing him? It's not because she's dead. It's because I fixed her. Since that time, she's never needed a reason to come back to Dr. So-and-so. And she said, it's amazing. But how did you do it?
Exactly. That's very amazing.
And I said, that's why I want to see this doctor. Okay. So what I'm getting at is, I am pushing the bar now. I'm going to these doctors because I've got something to show. And those things that I'm showing are sitting in their filing cabinets because it's their patients that they've not managed. So that's the kind of a scientist
that you are.
I am.
Most definitely, man, because you make me really think that there are people really out there that could be helpful this side. You understand? Only if this could really also happen and get fixed. Because you make me think about these other two patients that I know. You understand? One, I think, had a cancer, but she would keep on going there, having scans and everything, but is paying the medical aid, you know, but she's not really getting to the bottom of the issue. You understand? So it really reminds me that if only she could now probably come to you, let's say, you know, probably there'll be a different, you know, outcome. I'm sure you will probably, because you have your own method of doing stuff, but you're doing them correctly and properly. You understand? So I'm definitely thinking that this is a big issue and we definitely need to try and change it because people are really suffering.
People are suffering.
I mean, and in your perspective too, do you really think that the patients are the key sufferers here?
Before I answer your question, let's go for a break, and when we come back, I'm gonna answer your question and we take this topic further.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to ADALase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
Welcome back. We are touching on a hot topic here. The need for medical aid coverage to cover us, or not just us, but alternative practitioners in the same way they are covering conventional medical practitioners. So when we went for a break, I was just giving scenarios where I've pushed I'm poking the bears, you know, going to the doctor and say, this patient of yours, this patient of yours, this patient of yours, this is what I've done, this is the level I've put them at, and can we talk so that I can start intervening in other cases. So you were asking about whether the patient is the one that's taking the knock here. That's exactly the case. Yeah. The patient who's taking the biggest knock is not me. I'm not taking the knock. The kind of knock that I'm taking is just some kind of professional or emotional knock, because I feel it when a person or a patient does not have the money because they need to have cash to be able to receive my services, as medical aid does not cover. I feel it when I know I can fix this person, but the person does not have the money to pay for my medicines, you know. But the person who is really suffering the most is the patient, because the person who's sick, the person who's paying the money, the person who goes through all these motions and moving from pillar to post, not sleeping, not what, meanwhile is sitting with all, begging the medical aid, getting negative answers or whatever. It's the patient. It's the patient. So that is why I'm bringing this topic to the viewers, because they're the ones that are taking a flag out of all this, and we maybe can even come up with suggestions.
True.
I remember I did mention this once, a couple of times, maybe not once, that I had a politician, you know, he has since passed. And he was in Germany, and I think he was an ambassador. He was no longer a minister of sports when he came to me. He was in Germany. But he was here, and he said to me he was referred by some of his friends at Alice, because that's where he had his house. And he said, when my friends recommended you, they say you are good. I must come and see for myself. Maybe I will be able to be assisted in this problem that I'm having. And but after I had finished scanning him, he said, Tembi, my friends told me that you are good, but they did not tell me you are this good. He said, they didn't tell me you are this good, because you're giving me answers which even in Germany I could not get. Because he had bronchial problems, but nobody knew. He had respiratory problems, but nobody knew what was the problem. But I could pick up that it was just one bronchial tube that had serious issues. And he said the fact that you can even pick up, because I can feel it on one side. This pain, this menace that I've been experiencing, I feel it on one side. And everyone, I tell people, no one has ever been able to pinpoint. But for you, without me telling you anything, because my friend said I mustn't tell you anything, you will tell me what's going on. But now for you to be able to tell me it is one tube, it's enough. Because now you are giving me answers as to why is happening? Why is it, am I only feeling it on the one side? Meanwhile, they say my lungs, they have no problems about it. So that's what he said. And then he said, no, man, I'm going to use my political influence to make sure that your medical aid covered. And I said, be my guest, because medical aids are not owned by the government. Even though others, you find James, for instance, has got some kind, it's largely covering, but it's still the government. Maybe the unions may have a little bit of a share, but the government, they cannot come with their political clout and say, hey, we want you to cover this. I said, Pimaika, you never succeeded. I mean, they tried whatever they tried, and he came back. So he had to pay cash for his medication, and he could not help any other person after that. So what I'm getting at is that this is not something that is coming into the forefront now. It has always, but I have never been involved in the past in pushing it. It was just this guy who said, let me push it for you. But I did not even have hope that there was going to be any change, because I knew. But now I'm saying I am ready. Why am I saying I'm ready now? It's because I've accumulated enough evidence. And in various systems, cardiovascular, urology, neuro, pediatric, every area. There is no area that I have not touched where I've got substantial evidence to prove that I am capable. So that is why you find I'm bold enough now to say, okay, guys, let's join our forces and then see how far we can push the bar. So that is, that's why I'm bold now.
That's good. That's definitely good. But then one would argue again, Mama, are you really pushing here to help people, or are you not like some type of the others who are just pushing for the
to make money?
And what difference do you bring, compared to the conventional way? Because you are the very alternative, right? So what difference are you bringing here? To
Okay.
help?
Firstly, to first start with the question where am I not pushing my own envelope to make sure I make money? I'm making money anyway from the services that I am providing. I am making money. When I say I'm making money, it's not like I'm becoming rich, but I'm being compensated for the work that I am offering. But what hurts me, Luxolo, is that the services that I'm offering are a fraction of the cost of conventional medicine. And while it is a fraction, with me, remember with me, I don't have chronic, where you find, because with conventional, if they say you're diabetic, then you know you're going to be taking that medication for life. Even the medical aid covers that. With me, if I'm going to fix your chronic condition, because I'm in a position to see, oh, in your case, it's because of this is what it's, then I'm going to fix that, then voila, you're sorted. You're not going to keep on coming to say, okay, in 6 months' time, you're still coming to buy. No. The only time where you find I tend to sit with supplying services a little longer is in autistic children, where the problem is genetic. Because when it is a genetic problem, even with adults, when it is a genetic problem, I cannot fix the gene. If the gene is causing a problem in this particular area, I can't fix the gene. I can just fix the problem that is being caused. So in that case, therefore, you find I will be able to clean, but if the tap that's causing a pond there to keep on, I cannot, because the factory that made it did not do a good job, or I'm not saying God did not do a good job by creating you to have genetic defects. It's his call. You are his entity. He decides how he wants you to be. Okay. So, but if he decides to make you have a defect, that's his call. So my job, which also comes from him, because he's the one that has made me this a practitioner to be able to do this. So my job is to make sure that, okay, the pond, we keep on making sure that it remains dry. But I cannot stop that tap, which is a genetic defect, from creating. So I have to keep on watching and know that it's dry. Then we know maybe it's going to be dry for the next 3 months. Then we must check again. And then it's starting to fill up again. So except for those cases, which happen to be the case quite a lot with autistic children. Because with autistic children, you have to keep monitoring. Then, if there's mitochondrial disease, you cannot fix that mitochondria, and God has made it to be diseased. So it keeps on messing up, messing up. So you've got to keep on monitoring. You fix, then you find the child is fine. 3 months' time, you must check again. But when it comes to other illnesses, I fix so that you're on your own. Then I say maintain, live a healthy lifestyle. You must eat, you must properly like that. So what I'm getting at is, therefore, I don't create a situation where I must make sure that on a monthly basis, the debit orders, that come from you. No, I don't work like that. So I'm not pushing the financial envelope. I want to fix this because it's not nice to be sick. Nobody wants to be sick. So if God has given me that ability to take you out of that agony, that my task is to take you out of that agony, and then you are on your own. But now the medical aid is the one that is entrusted with the funds to help you pay for the whatever is on offer that takes you out of that agony. So what I'm pushing, therefore, is that the medical aid must assist you because you've provided for that. so that you're not taking money that you're supposed to use to buy for your food, for your petrol, for your what, then you end up using to buy medication from me while you are contributing towards the medical aid that's supposed to cover for that. So therefore, in that sense, I'm not pushing with the envelope, because at the end of the day, like I'm saying, whether it is the medical aid that pays for the medication or it is you, but someone is paying for the medication. So by me pushing that we must have medical aid coverage, it doesn't mean you're going to end up paying more than what you are paying just because now there's medical aid coverage. No, if it costs 20,000 to have this service, whether it comes from medical aid or from you, the cost is 20,000. So therefore, but now I'm helping you because you've got money that's sitting there that's supposed to, where you're supposed to throw that 20,000 from to cover for that service. So I'm helping you because I know you need, and I know I've got stuff that will take you out of this agony, you know? So I'm not pushing the financial envelope more than I'm trying to assist so that you at least, because at the end of the day, I would say, who cares? You can organize the money if you can. If you can't, then it's I can't help. So it's your problem. But I'm making it my problem also because at the end of the day, you're my patient. I care what happens to you. I care that your health, your well-being is taken care of, you know. So I'm not pushing the financial envelope, okay?
I think I've got the answer now. Like,
yeah.
So like, where does the Constitution like come into this play, you know? And is it not befitting in this case?
Well, it is, because at the end, you must remember, the Constitution, with its Bill of Rights, it looks at what are the rights of an individual. And the rights of an individual, access to health is the right of an individual. That is why you find that we've got the Department of Health. It's because that is the fundamental right of every individual to have access to health, okay? But now, the government can do so much, whether it's out of whatever reason, corruption or inefficiency or ineffectiveness or whatever the reason, but it can do so much. So for people who can manage or who can afford to make alternative provision rather than relying on the government, and therefore they do make provision for that, but have got no voice over how that should happen. That's where the Constitution, I think, should come in. Because I feel at the end of the day, if I am paying for a particular service and I've entrusted those funds to this particular entity, that entity must have a right. They must still have a right, have a say. I cannot just be dismissed and I'm at the mercy of whether they say yay or nay. I must be able to say, this is what I want, but at the end of the day, I must also respect the fact that this entity must be allowed to run efficiently, not because my interference keep, you know. So that's why there are systems in every institution. Make sure that it guides operations of that entity. So my point, therefore, is that I am actually exploring that, you know, because there are people, I mean, one patient even said to me last week, she even said to me, if you want signatures, tell us, you want 100,000 signatures, you want 1 million signatures. She said, we will get those signatures. But she's the mother of an autistic child. And she said, with this autism, parents are suffering. You know, they don't know where to go with their autism. And you are the breath of fresh air. You come with explanations. She said, before we talk treatment, we can now relate to what is going on in our children. When you see your child giggling out of nowhere, sleeping, like, you don't think, it's because maybe she's having a dream, or she's seeing Makulu who's passed on is playing with her or whatever, all those explanations that people normally come up with. She says, but now we've got a medical explanation why this child giggles like this only when she is sleeping. Because not only do you do that to explain, when you then you treat, and then we find the giggles stop. Now we can relate to what you are telling us. Now we can believe that it's not because you're just guessing. You tell that they giggle, and the fact that you tell us that the child is having seizures, not because you not only that you are specifying that they will either giggle but sometimes they twitch, things that are associated with seizures, and yet it's something that's serious. And then you give a treatment, and then the twitches and the giggles stop. So she says, we have proven, we've got answers, we have proven, we accept that you know what you're talking about. You know what you are doing. You're not guessing, you are a scientist. You know, you can observe, you can prove, you've done it before with this, and she said, but the fact that you are not medical aid covered, because when you give a bill and you've worked out that you must treat the epilepsy this, you must stimulate that brain there, the human growth is so low, then this child cannot talk, now you have to clear. You map out all the things that are happening and that you're supposed to treat. And the bill is this big. But then the money must come from my money for my car installment. My money because I want my child to be right. Meanwhile, I'm sitting with 500,000, balance in my medical aid that would be covering this. So she said, tell us, if you want million signatures. I said, well, I haven't even considered the signature route. I had not. She's the one that gave me that idea that because signatures are saying you've got the backup of us as parents or as patients, we do want this. We are our voice. And then I said, well, I had not looked at it from that angle. I'm going to explore that avenue. But I was just still talking to some lawyers, constitutional lawyers. And I was saying to them, you must not think because I'm talking to you, I'm going to be paying for this. This is also your constitutional responsibility, your citizens' responsibility to make sure that this thing is covered, so that you need to cover this kind of a case as a pro bono, So I've spoken to them in that, I don't know if that, because I won't be able to afford those kind of costs, So what I'm getting at is I'm bringing it back to the viewers because it's not going to benefit me more than it will benefit them. It will benefit me, of course, but it will benefit them more than it will benefit me, because at the end of the day, like I'm saying, even though this parent was making an example, she said, but at the end of the day, I've got to rake the money because I want my child to have a life. So and then she rakes the money. But it doesn't mean I'm not going to get paid. I do get paid, but it is my responsibility, both as a professional, as a citizen, as a South African, if not even beyond South Africa. Okay. So that's the viewers are still, so maybe I'm still gonna let me know, so maybe I'm still gonna come back to you, but I would like to hear your views. What do you think you can do on your part? So we're bringing it back to you, because at the end of the day, it's all about you. You need to explore different avenues that you think you can adopt, so that we can start instituting proceedings towards this Constitutional Court, here we come. Here we come. We're still gonna talk more about this. We're still gonna even bring some lawyers to the show who will also give you their perspective as to what is doable and what is not doable, whether this is a pipe dream. But my belief is it is not a pipe dream. For as long as we have a constitution and we're not pushing the rights that we are not entitled to, these are the rights that people are entitled to. So keep watching. It's going to be an interesting ride.
It's going to be a very interesting ride. I'm
Yeah.
very happy of already where it's going.
Yeah.
I'm so excited to where it will. But for today, we end it here.
This is where we end our show today. Thank you for watching and goodbye.